afternoon, Mr. Johnson. My name is Kester Angeles, and I'm going to be a nurse practitioner today performing your physical assessment. How are you?
Good, how are you?
I'm great, thank you. Can you tell me your full name?
Adam Johnson.
Can you tell me your date of birth?
June 15th, 1988.
Alright, so I'm going to do the physical exam now, but before that, let me just sanitize my hands. Great. First, I want to check your vital signs. Check your blood pressure. Can you kindly roll your sleeves up? Out of the way. That's enough. Just put your arms down. And your blood pressure is 120 over 80. Is that your usual blood pressure?
I don't know.
Okay. Well, that's a normal finding.
Okay.
So that's a good one. 120 over 80, that's normal. So now I'm gonna quickly check on your pulse rate. Palpate your radial artery. Alright, so your heart rate is 90, which is a normal finding. Now, I'm just gonna quickly observe for the rise and chest of your fall, of your chest. Alright, your respiratory rate is 16, so which is a normal finding. I know that my secretary already checked your temperature earlier, and your temperature was 98.5. That is a normal finding too. So now I'm gonna start quickly checking on your body. Do you have any itchiness or lumps or any like skin abnormalities that you noticed so far?
No.
Okay, great. So it looks like the patient is well kept. I don't see any irregularities or any skin problems. It's also reported by the patient. There's no skin abnormalities that he noticed recently. So now I'm gonna quickly check on your scalp. Inspect the scalp. So I see that there's no flakes, there's no lice, or there's no nits. The hair is evenly distributed and it's thick and coarse. The contour of the head is also normal. I see that it's normocephalic. The face doesn't look like there's any drooping or any asymmetry, so that is good. So now I would want to palpate the temporal arteries. It's palpable, it's +2, which is a normal finding. So now I'm just gonna let you do some facial exercises. Can you raise your brow for me? Great. And then can you puff your cheeks? So we're checking cranial nerve number 7, which is the facial cranial nerve. I don't see any asymmetry, which is a normal finding. Now I'm gonna quickly check on your eyebrows. The eyebrows look evenly distributed. Looking at also the eyes of the patient. The conjunctiva looks pink. I don't see any redness, which is a normal finding. The inner canthus and then the lateral canthus look healthy. The patient is not also complaining of any eye dryness, so that means that the lacrimal duct is functioning properly. Also, I can see that the sclera is white, and then the pupils of the patient is +2 or +3. It's not dilated, and also you can see the iris is kind of like brownish to greenish in color, and the optic discs are like with clear edges or well-defined edges, which is a normal finding. So now I'm gonna let you read the chart. So I have a Rosenbaum chart over here. Can you kindly cover your right eye for me, please? Now we're checking for cranial nerve number 2, which is the optic nerve. Can you kindly read the bottom line?
LTFPH.
Okay, can you cover your left eye? Can you read the second line at the bottom?
CFDHJ.
Okay, do you wear contact lenses?
Yes.
Okay, so that's fine. Since you're wearing contact lenses, that really helps a lot. I believe that you're getting your annual ophthalmology check, right? Optometrist.
Yes.
Okay, so now I'm gonna proceed with my eye check. So I want to check for your reaction to light, direct. So pupils are reactive to light. Now I'm gonna check for the consensual reflex. I'm gonna shine the light on the left eye and see for a reaction on the right eye. Okay, so the right eye is reactive to light while I was shining a light on the right eye. Doing the opposite side. Okay, so the left eye was constricting when I shone light to the right eye. So now I'm gonna check for accommodation. Can you kindly look far over there? And then I'm gonna switch your direction over here in your vision so I can see that the pupils reacted to it, so that's a positive accommodation. Now we're gonna check for convergence. Again, gonna let you look at the pen light, move it closer. So the eyes moved inward, which is a normal finding for convergence. And now I'm gonna check for the extraocular movement of the patient, which is also other way of like checking for cranial nerve 3, 4, and 6, which is oculomotor, trochlear, and abducens. Now can you kind of look at the pen light, just follow it. Alright, so I don't see any deviation in the eyes, no nystagmus, so cranial 3, 4, and 6 are all intact. Now I am gonna ask you to cover your right eye, and then I'm gonna move my fingers, wiggle it, and just gonna be checking your peripheral vision. Let me know, just say now whenever you see my hands, my finger.
No.
Alright, great.
No.
Okay, cover the other eye.
No. No.
Alright, that's great. It's a normal finding. So now I'm gonna be checking for your eye using this ophthalmoscope. Right. Just quickly. Alright, so the right eye, I see the red reflexes over here. No AV nicking and no papillary edema. Optic discs are also well defined. I can also appreciate the macula here. And the other eye, same finding, no AV nicking, no papillary edema, and I see red reflexes with optic disc edges that are well defined. I can also appreciate the macula here. So that's for our test. But by the way, I wasn't able to check for the blurry reaction earlier because I was just checking the direct reflexes. Okay, so both pupils are reactive to light, +2 in size, and both were brisk on light reaction. So now I'm gonna check for your nose. But before I check for your nose, I wanna check also the cranial nerve number 5, which is the trigeminal nerve. So now I want you to close your eyes and let me know whenever you feel this cotton on your face.
No.
Okay, so that's the temporal lobe. How about this?
No.
It's the masseter. How about this?
Yes.
That's the mandibular area. So the sensory of the patient for the trigeminal nerve is intact. So now, trigeminal nerve is both sensory and motor. So now we're gonna check for the motor aspect of that trigeminal nerve or cranial nerve number 5. Can you kindly clench your jaw like this? Okay, open your mouth. Any pain?
No.
Okay, so that means that the patient has an intact cranial nerve number 5. Specifically, it's like motor function. So now we are gonna proceed with assessing the nose of the patient. So I can see that there is no deviation, nasal septum is in midline, no deformities as well. Now I'm gonna feel it. Is there any tenderness?
No.
Alright, so the facial and the sinuses, maxillary sinuses, there's no tenderness on palpation. So now I'm gonna let you close your eyes. I'm gonna ask you to smell like two things and you let me know what you smell. First one is,
Coffee.
that's right. How about this?
Vanilla.
Vanilla. Perfect. We got it all correct. So I actually checked the olfactory cranial nerve, which is cranial nerve number 1. So now I'm gonna look into your nose using my light over here. Just look up for me. Okay. The basal passages seem normal without any polyps. There's also no obstruction or no excessive nasal discharges. Can you kindly cover one of your nostrils and breathe in and out? And then the other one? Very well. I can see that I can hear that the patient is breathing well, so there's no issue there. So the olfactory nerve is again intact as I assessed it earlier. So now we're gonna check for the oral health of the patient. I can see that the lips are symmetrical. I don't see any chancres or any cracks or crevices noted. There's also no other abnormal finding. Can you kindly give me a big smile, please? Teeth are, looks like it's complete, both upper and lower. It's straight. Can you kindly give me a bigger smile, please? I can see the gums here are looking pink, and I don't see any like signs of redness or inflammation, such as in the case of gingivitis. So now I'm gonna ask you to please kindly open your mouth. Stick out your tongue. I see that the tongue is, it doesn't look like it has like hairy appearance. It looks pink and there's no ulcerations or chancre. Can you lift your tongue up? The frenulum is also at the midline. I don't see any sore or inflammation. Looking at the mucous membrane over here, it looks pink and there's no lesions as well. Can you put your tongue down? Just gonna stick your tongue out for me, please. I can see the uvula is in the midline and then the tonsils are like plus 25, so that is a normal finding. It's a grade 2. So can you kindly once again stick out your tongue, move it up and down, side to side. So this movement of the tongue, the responsible cranial nerve for that is your cranial nerve number 12. The motor aspect of it is the hypoglossal nerve. In terms of the taste of the patient, if you want to test that, the one that's responsible for it would be cranial nerve number 7, 9, and 10. So the anterior aspect, 2/3 anterior aspect of it would be your cranial nerve number 7, that's your facial. Cranial nerve number 9 is your glossopharyngeal, and then cranial nerve number 10 is your vagus nerve. So that's for the sensory or the sense of taste of the patient. But in this exam, we're not gonna let the patient taste anything. So now we're gonna proceed with checking for the ears of the patient or the auditory health of the patient. So first, I'm gonna inspect the auricles. I want to feel it too. Is there any tenderness?
No.
It looks symmetrical. I'm gonna press the auricle. Any tenderness?
No.
Great. Now, I'm gonna look into your ear. So when you when you check for the ear, you pull it up and back for adults, and backwards and up for children. I can see that the ear canal looks. There's no obstruction, there's no excessive cerumen. I can also see the cone of light on the right side of the ear at 5 o'clock. And I can also appreciate the tympanic membrane that is pearl green color. So moving to the left side, again, up and back, same finding, ear canal is clear, no excessive discharges, tympanic membrane is gray, pearl gray color, and then the cone of light is at 7 o'clock angle on the left ear. Now we're gonna check for the hearing function of the patient. So this is the vestibulocochlear nerve, which is the cranial nerve number 8. So I'm gonna whisper some words, and will you tell me like what did you hear?
1, 2, 3.
And the other side,
ABC.
you got it right. So cranial nerve number 8 is intact. Now I want to check for the neck aspect. Starting off by checking the lymph node of the patient. So the pre-auricular, post-auricular, the occipital, pre-cervical, deep cervical, superficial cervical, posterior cervical, the submandibular, submental, tonsillar, the subclavicular, supraclavicular, and then the postclavicular. I don't appreciate any swollen lymph nodes, which is a normal finding. So that's it for the lymph nodes. Now I want to check for the trachea of the patient. I can see here that the trachea is on the midline, and I don't see any lumps that would indicate that the patient has a goiter, but we want to palpate it to really solidify our finding. I want you to give me a big swallow, please. Okay, I can feel the thyroid, but it's not swollen, or there are also no complaints of tenderness. So now we are getting back to the ears. I want to check for some ear problems, if there's any. I'm going to strike this tuning fork and let me know when you hear it.
Hear it.
Okay, is it lateral? Is the sound equal on both sides?
Yes.
Great. So now I'm gonna do the Rhine test. By the way, the first test that I did was the Weber test. Now the Rhine test, I'm gonna put the tuning fork again on your mastering process, and I'm gonna move it right in front of your ear. So let me know whenever you hear that the ringing has already stopped. So just say now. Other side.
Now.
Okay, so it seems like the air conduction is greater than the bone conduction. That means that it's a normal finding. So that is our hearing test. So now I'm gonna quickly check on your chest. So looking at the anterior chest, it seems like it's symmetrical in shape, and the rise and fall of the chest seems normal. The patient is not using any accessory muscles, which is a normal finding. So we're gonna expose her chest real quick. All right, now I wanna palpate it to feel for any lumps or any tenderness. I don't feel any tenderness at all. Now I'm gonna percuss it. It's resonant on all regions of the chest, which is a normal finding. I can also see that the anterior-posterior diameter is normal, which is 1 to 2. That is great. So now I want to quickly assess and listen to your lungs. Can you give me a deep breath, please? Inhale, exhale. Inhale, exhale. Inhale, exhale. And exhale. 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 Alright, thank you for your patience. The lung sounds, the lung fields are clear on auscultation, which is a normal finding. So now I'm gonna ask you to move over here, face me, and then you can actually sit on the side of the chair, just face there. Perfect. And now I'm gonna check for the posterior aspect of your chest or your back. Is it okay if I lift your shirt up, sir?
Yeah.
Okay, very well. And then just gonna cover you up over here, give you some privacy. So now inspecting the posterior or the back of the patient, I see that it's also symmetrical. I don't see any lumps on palpation. Also, I'm gonna percuss it. It's resonant, which is a normal finding. Now I'm gonna ask you to, whenever I lay my hands on your chest, I'm gonna go up and down. I want you to say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Alright, so I can feel the vibration, so we're actually assessing for the tactile fremitus. Also looking at the chest expansion of the patient. Sir, I'm gonna lay my hands on your mid portion of your back, and I want you to like give me a big inhale and exhale. Take a deep, yeah, okay, very good. So I can see that my hands expanded when the patient gave me a big inhalation and exhalation, which is a normal finding. So now we are gonna assess for the diaphragmatic excursion. So, sir, I'm gonna ask you to like take a deep breath and hold it. Hold it. Okay, there's dullness here, so I'm gonna leave a mark. Alright. And then now give me inhale. Okay, very good. And now we're gonna do the opposite thing. I want you to inhale but hold it on exhalation. Okay, marking it here. That's the point of the dullness. So I can see that the diaphragmatic, the size of the lines that I have here is around 4 centimeters, which is a normal finding. So now I'm gonna assess for auscultate the part of the back part of the patient. Check for lungs, inhale, exhale, exhale, exhale. And exhale, and exhale, and exhale, and exhale, and exhale, and exhale, and exhale. Very well. So lung fields are clear on auscultation. So now I'm gonna be checking for bronchophony, egophony, and whispered bacterioloquy. So I'm gonna be using my stethoscope, and first off, we're gonna do egophony. So would you kindly say E whenever you feel like my stethoscope is on your lap? So just say E.
E, 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 E.
Alright, so I heard muffled sounds, which is a normal finding. There's no consolidation. Now I'm gonna check for whispered bacterioloquy, which is also the same thing that we're checking for consolidation. So, but this time I'm gonna ask the patient to say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Alright, perfect. So that's your whispered bacterioloquy. Now I'm gonna check for bronchophony. So now I'm gonna be asking the patient to say 99.
99.
Alright, thank you very much, sir. So now that ends our assessment for your chest. So now can you kindly face me again? Right, so now we're gonna be checking for the cardiac function of the patient. So we're gonna be checking all of the landmark or points of like heart sounds for the patient. So we have our aortic, we have our pulmonic valve, we have our Erb's point, the tricuspid, and the mitral points. So So I first use my diaphragm of my stethoscope in hearing for the heart sounds of the patient. I didn't hear any murmurs or any gallops or any abnormal heart sounds. So now switching it over to the bell of my diaphragm to listen for low pitch sounds or high pitch sounds. Alright, so it's the same finding, no murmurs, no gallops. So that is a normal finding. So now we're gonna further check for the cardiac function of the patient by asking the patient to move over to our bed, and then yeah, that's right. So now we're gonna check for the JVD or the jugular vein distension. So I actually don't appreciate the JVD here, which is a normal finding. We would only appreciate it for cases of CHF or congestive heart failure. Now we're gonna check also the other side. I don't see any JVD. Now we're gonna palpate for the carotid pulse. We have to do it one by one. So I'm just gonna lay my hand over here in her neck. It's palpable, it's bounding, but it's just +2, which is a normal finding. Moving on to the other side. It's also palpable and it's +2, which is a normal finding. Alright, so now we're gonna check for the vascular aspect or vascular system of the patient. Can you kindly go back to the chair, sir? Alright, so I want to inspect everything first, like the extremities of the patient. I don't see any edema or any cyanosis. Or can you kindly like lift your hand up like this? Your fingers, it doesn't look like there's any cyanosis or clubbing, like such as in the case of COPD or any congenital heart problem. So that is a normal finding for the patient. So now I'm gonna assess for the pulses of the patient, starting off with the radial pulse. It's +2 and it's bounding. The brachial pulse, and the other side, +2 and it's bounding. And I want to check for the femoral. Can you kindly like separate your legs a bit? So I'm just gonna put my hand over here in your close to your groin area. Okay, both femoral arteries are palpable. You can also check for the popliteal. It's +2. Now for the dorsalis pedis. Thank you. It's also +2, and then the ankle brachialis or posterior tibial. Feel it. You can feel it. Dorsalis pedis is also +2, which is a normal finding. So that's it for our vascular aspect. So now I'm going to be checking for your musculoskeletal system. Sanitize my hands first. So now I'm going to be checking for your gait and your posture. So can you kindly stand up for me, sir? Alright, so move backwards, and I'm going to be asking you to like move towards me, and then also move back to where you're standing right now. We're gonna do this in like different tests. So first off, I want you to like walk normally towards me. Very well, and then going backwards. I see that the patient has a steady gait. I don't see any wobbling or any problem with his balance or coordination. Now I'm gonna ask you to do the heel to toe test. So you're basically just move your foot right in front of your other foot and keep walking towards me. If that's enough. Turn. Very well. And now I'm gonna ask you to walk towards me with using the balls of your foot. On the other side. And now the heel of your foot. Same finding. there's no difficulty, and the gait of the patient is also steady. Now I'm gonna be asking for the patient to do to close his eyes. So now what I'm doing is I'm doing the Romberg test, but ideally this should be done like without like when the patient is standing like right in front of the wall, or the back of the patient is against the wall, so that we ensure that the patient doesn't fall, because there's a wall right behind him and you're going to stand in front to secure the front part of the patient in case he falls face front. So now I'm going to ask you to close your eyes and put your hands on the side for 15 seconds. So it looks like the cerebellar function of the patient is intact. There's no ataxia, and there's no loss of balance. Otherwise, if the patient closes his eyes, then he would lose his balance if there's a sensory ataxia. So that's it for your gait and posture. So now I'm going to quickly check on your spine. Here, I'm going to palpate it. Do you feel any tenderness?
No.
Alright, great. So that means that the patient is not having any spinal issues as far as our palpation is concerned. So now I'm going to be checking for your spinal cord. So I'm going to be asking for you to like bend forward, bend, okay, move, stand up, and then bend backwards as far as you can go. Great. And then you do side to side. Great, that's great. And then now I'm going to be specifically checking for the specific aspects of your spine. So starting off with the cervical spine. I know you did it earlier, the front and the backward. That's a way of checking for your cervical spine too. But what I want you to do now is to let your ear touch your shoulder as far as you can go. That's fine. If you can touch it, that's fine. So I can see that the range of motion was full, there was no difficulty, and there's also no pain, and it's also symmetrical. So now I'm going to ask you to like touch your chin to your chest and go backwards. Okay, so I don't see any difficulty in that specific range of motion. So now I'm going to be asking you, or we're going to be checking for resistance. So I'm going to apply some pressure over here. Look on your right, very well. There's a good strength on the other right, so it's a +5 for maximal strength. So now I'm going to be checking for thoracic, which we already did earlier when you touch your toes. So now I'm going to be asking you to like sit down again, and we're going to do the straight leg test. This test would basically check if the patient has any like back pain, such as sciatica. So lift your leg up. Is there any pain?
No.
Otherwise, if the patient has sciatica, the patient wouldn't be able to like lift his leg up because of the shooting pain that the patient would feel as soon as you lift the leg up. So now we are gonna check for your joints. So starting off with your temporomandibular joint, is there any pain here?
No.
All right. I know that I asked earlier to move your jaw up and down because we were actually checking for cranial nerve number 5, which is the trigeminal nerve, which you were able to do like completely without any difficulty. So we're gonna skip that. Now I'm gonna check for your shoulders, arms, and elbows. So I want you to like extend your arms like this, up, and then down. Very good. There's no difficulty in that movement. I want you to like flex your hand, your arms, extend, and then flex. Alright, I don't see any difficulty there. Now I want you to do internal rotation. Do this, and then downwards, external rotation. Very good. Now we're gonna check for the elbow. I'm gonna ask for your palms to be in supine position. Alright, very good. Any difficulty? And pronation. Great. And then I want you to like rotate your arms with the wrist like this. Very well. So now I'm gonna be checking for the wrist of the patient. Is there any pain, sir?
No.
Any pain?
No.
Alright, great. Now I'm going to be checking for the phalanges, metacarpal, proximal, distal, metacarpal, proximal, and distal. And then I want you to fan out your fingers, and then I'm going to apply some resistance. Feel anything? Great.
No.
And then close it. Try to open it up. Okay, some resistance. Great. So you're able to move it without difficulty. So now I'm gonna be asking you to like put it down. Now we're gonna check for your knees. I want you to like lift your knees up for me, please, like this. Great. Okay, great. How about this? Great. How about to the side? How about this one? Right, great. There's no difficulty in that movement. Now I'm gonna ask you to like go back to the bed because I'm gonna be checking for your hips. So now put your legs down, and then I want your left leg to go up to your chest as high as you can. Great. And then how about the other one? Great. So that's the hip flexion extension. Now going back to your right leg again, I want you to do to move your leg to the outward, to the left. So that's, we're checking for internal rotation. The patient doesn't have any difficulty of moving it. Any pain, sir?
No.
Right, move it backwards, inward. So that's external rotation. So the patient is able to like freely move his hip joint without any difficulty. How about the other side? Outward. That's internal rotation, inward, external rotation. There's also no difficulty. I can see that it's in full range of motion. So now I'm going to ask you to like go back again to the chair, sir. Thank you very much for your patience. And now the ankles. So this is basically just I'm asking the patient to dorsiflex and plantar flex the patient. Like so, yeah. So this is dorsiflex, plantar extension. And then can you rotate it? Inversion, eversion. So which is a normal finding. The patient has a full range of motion. So now I'm gonna be checking for the feet of the patient, the metatarsal. I don't see any redness, any nodules in the case of arthritis. Also the proximal tarsal phalangeal joints are the same finding, and then the distal, same is also true on the other side, so which is normal. I'm just gonna use my sanitizer. Alright, so now we're done with the musculoskeletal system assessment. So now I'm gonna be checking for your mental status, which I already asked earlier, so I'm not gonna be asking for your name again, and date of birth and all those things, but I just wanna ask you, like, do you know where you are right now? Like which floor you're at?
Manhattan.
Very well. Do you know what year are we in now?
2025.
And what's the date today?
May 5th.
Do you know who's the president of the United States?
Donald Trump.
Okay, great. You answered it correctly, so we can say that the patient's mentation is intact. But we also want to check for the remote memory of the patient and the short-term memory. What did you have for breakfast earlier, sir?
A bagel.
Very well. Can you remember, like, what did you do on your birthday last year?
I was in Mexico with friends.
Okay, so you can tell that the patient was able to respond clearly, and it seems like he knows well, like the recent memory and even the short-term memory. I mean, short-term and the recent past. So now I'm going to be checking for your motor function. So starting off with the big muscles, can you kindly flex your arm like this? I'm going to be checking for the biceps. Okay, I'm going to do some resistance. All right, I see some resistance there. It's +5. Now checking for the deltoid. Put your arms on the side. You're going to be pushing your arm down. Okay, good resistance. Now checking for the triceps at 90-degree angle. I'm going to push you and going to make some resistance. That's great. And then push inside, great. And push outside, very well. So those big muscular groups on the upper extremities are all +5. That means that its muscular strength is really great on maximal resistance, and both sides are symmetrical. Now we are gonna check for the quadriceps. I want you to like raise your leg up, very well. Hips too, and then outside, very well. And then how about the leg up, knees up, great. Legs, and then knees, and then legs. All right, very well. So now that is for our motor function. I'm gonna be checking for your sensory function now. So this is gonna be a couple of tests. First off is that I want you to close your eyes and let me know if you feel anything.
Yes.
I'm pinching it right now.
Yes.
Do you feel like both sensation equal on the left and the right?
Yes.
Okay, great. How about this?
Yes.
Great. How about
Same.
this? Alright. So that's for pain sensation. Now we are doing the sharp and the dull test. So I want you to keep your eyes closed again. Extend your arms like this. I want you to let me know if it's sharp or dull.
Sharp. Dull.
Other side.
Sharp. Dull.
Okay, very well. So now that's good. I'm gonna also gonna be checking for your light senses and deep palpation senses. So extend your arm again. Let me know how you feel. What is this? Is it light or
Light.
okay? How about this?
Heavy.
Okay, it's deep, right?
Deep.
Great. Right. So now I'm gonna be checking for the vibration sense. So typically for a patient with neurovascular issues, such as in the case of peripheral neuropathy, this is the first sensation that they lose, for usually seen in diabetic patients. So I want you to let me know if you feel the vibration. I'm gonna let the tuning fork rest on your leg. Can you feel it?
Yes.
All right, other leg.
Yes.
Okay, very well. So that means that the patient doesn't have any neuropathy or any problems with his nerves. So now I'm going to be asking you to identify some objects that I'm going to be putting in your hand.
Okay.
So I'm going to be checking for stereognosis. You kind of close your hand and open your palms for me, please. Can you identify what object am I putting in your hand?
Phone.
Great. And then, how about this?
Glasses.
Great. So you got it correctly. So now I'm gonna check for graphesthesis. I'm gonna draw a number. What's this?
2.
Great. How about this? Letter?
H.
Very good. You got it right. So that's it for your sensory. And now I'm gonna proceed in checking your deep tendon reflexes. First off, I want to check for your biceps. Oh, not that. We're checking for deep tendon reflexes. What am I grabbing?
It's in the corner.
Okay, it's positive. Okay, positive. Moving here. Okay, very good. Up here. Very good. And then brachioradialis. Okay, so a little bit of movement there with this. And then now we're doing for the quadriceps or the deep tendon reflexes. So the foot of the patient is suspended up in the air. Okay, I see that +2. Okay, very well. And then now I'm gonna check for the ankle. Very well. Okay, very well. Very well. Very well. So the ankles and the brachialis is plantar reflexes are okay. So lastly, can you kindly go back to the bed? I want to quickly assess on your Babinski reflexes. Feet up here. So what I'm gonna do is gonna draw an inverted J. Okay, so the patient did react. So which is a normal finding. Well, actually the toes curled inward, which is a normal finding. In the case of abnormal finding, that would be like fanning out of the toenails or the toes, which means that the patient has a positive Babinski reflex. I'm going back again to the gastrointestinal aspect or the abdominal physical assessment of the patient because I missed that earlier. So first off, I'm gonna ask the patient to lift your gown up for me. I'm gonna give you some privacy over here. Thank you. So inspecting the abdomen of the patient, it doesn't look like it's distended. it's protuberant. It's a abnormal finding. Wanna percuss it. Well, actually, for abdomen, we were doing a different technique. It's inspection, auscultation, percussion, and palpation. So after inspecting, I wanna auscultate it. Alright, so auscultation is normal. There's like positive borborygmi, active bowel sounds in all region. And now we are gonna percuss it. So it's all tympanic on all region. And now we are gonna do the light palpation and depulpation. But before that, I wanna first check or first percuss for the liver and the spleen. So starting off in the lungs, the chest of the patient, it's resonant, and then once you hear the dullness, you mark it, and then starting from the hip area, tympanic, and then you hear the dullness. That's where you mark the lower margin or lower border of the liver. So as I can visualize here, it seems like the size of the liver is within normal. It's at 8 cms approximately, and the normal value is 6 to 12. Now we're gonna percuss for the spleen. So starting off and marking the lower sternal, the lowest, what do you call this, the rib cage. That's where you start palpating for the spleen. So it's tympanic. Yeah, so typically you wouldn't really be able to like clearly percuss the spleen, but if you feel like there's a large area of dullness, that means that the patient has splenomegaly. So that's it for the percussion. Now I'm gonna do some light palpation and depulpation, and we're also gonna palpate for the liver and the spleen. So light palpation first. Any tenderness, sir?
No.
Great. How about this?
No.
Great. Alright, so that's a depulpation. Now I'm gonna try to ask the patient to inhale and then exhale while I insert my finger on the right lower rib cage. I can feel the lower aspect of the margin of the liver. So for the spleen, so I didn't feel the spleen, which is a normal finding. So now I'm gonna ask the patient to stand up a bit. And then I want you to sit down over here. And then actually, I also think that I haven't assessed your vertebral angle or to check for any kidney like abnormalities. I wanna like just quickly check on it. So turn around, and then I'm gonna tap your back. So this is assessing for costovertebral tenderness. Let me know if there's any pain.
No. No.
So the patient didn't complain of pain, which is a normal finding. And I think that concludes our physical examination for today. Thank you very much for your patience. And if you have any questions, just the number of my office, and you can always ask me anything regarding your health.
Thank you.
Thank you.